nation got a report card on obesity today, and the country flunked. Despite
As we begin this new decade, the country is facing a dangerous weight problem.
What is officially the biggest health crisis in American history.
Nutritionists say obesity is the biggest threat to public health. New studies out today that draw the same disturbing conclusion. Americans are not winning their battle against obesity.
The evidence of an epidemic is everywhere. 2/3, 190 million Americans, are overweight or obese.
Despite all attempts to attack the problem, a new survey shows the adult obesity rate increased in 23 states last year, and no state showed a decline.
But also that more than a quarter of the population is obese in 2/3 of the states.
In the late 1970s, 15% of American adults were obese. By the early 90s, that number had jumped to 23%, and most recently, 35%.
Today's study says the fattest state is Mississippi, where nearly 1/3 of all adults are obese. The slimmest state is Colorado, but even there, 19% of the adults are obese.
We're spending $150 billion a year treating obesity-related illnesses, so we know this is a problem and there's a lot at stake.
Not even her exhortations seem to be getting through, because this new study published today in the Journal of Adolescent Youth looked at more than 6,000 middle school children across the nation and found that nearly 7% are not obese, but severely obese, in the 99th percentile for weight, which means the problem is worse than believed.
Childhood obesity has tripled in the last 30 years. This could be the first generation since the Civil War to have a shorter life expectancy here.
3 out of every 4 children are either overweight or obese.
That means about 70 of these children are on a high-risk trajectory for coronary artery disease by their 30s and 40s. Dr. Joshua Samuels treats kids with the blood pressure levels of an unhealthy adult. He likens the war on obesity to the one against tobacco.
The parallels are stunning. Marketing to children, distorting the science, influencing policymakers and the like.
If we can help somebody control obesity, they are less likely to get diabetes, and if they are less likely to get diabetes, that means that we are going to be saving a whole lot of money in hospital costs.
Health experts have been calling for big changes for years, and to be honest, not much has happened. Not much has happened. Not much has happened.